Hi, beautiful people. It's Wonderful Wednesday. I'm April Roll, your ER doctor online, and September is National Sickle Cell Month. In this video, I am going to tell you what sickle cell is. I'm going to give you some statistics about the condition, talk about some related conditions and complications that can be associated with it. I'm going to give some tips on how to stay healthy if you do have sickle cell disease, and also how you can help even if you don't. So, sickle cell disease is an inherited blood disorder, which basically means that you can only get sickle cell if both of your parents either have the sickle cell trait or they have some type of different hemoglobin or beta thalassemia or even sickle cell. Each parent needs to have the one or a combination of these conditions. You can't get sickle cell if both of your parents don't have sickle cell, or like I said, the other genes that code for those other types of hemoglobins and beta thalassemia. So, sickle cell disease also means that your red blood cells are sickle shaped or they're hardened. And this, like I was saying, can lead to some of the related complications and conditions to sickle cell because of this sickled and hardened red blood cell. These abnormally shaped blood cells basically can cause blockages in the blood, and those blockages can lead to things such as unpredictable pain and chronic pain. It can lead to extremity swelling. It can lead to lung and kidney problems, problems in the joints. It can lead to anemia, and most of the time, or I shouldn't say most of the time, but times when patients with sickle cell disease get in crisis, their hemoglobins can be low, causing them to require blood transfusions. So I just want to go over some stats right now. I'm going to be making sure to look at my notes so I will remember. So 1 in 13 African Americans carry the sickle cell trait, and many of them don't even know it. So, like I said, that's the stats for African Americans. Latinos are the second group most common to have sickle cell trait. And even though this is true, sickle cell disease is a global thing, and it is present in many ethnic backgrounds, not just African Americans and Latinos. So, an estimated 100,000 people in the US have sickle cell disease, and approximately 2,000 babies are born annually in the US with sickle cell disease. Now, the diagnosis is usually made at birth because there is newborn screening available, and that is the time where one would find out. Let's just say if both parents didn't know they were sickle cell carriers, and their baby ends up with sickle cell disease, that's something that is usually discovered at birth. So if you do have sickle cell disease, things that you can do to stay healthy, because with sickle cell disease, if you're proactive with your health and your health care, you can live full lives, but this depends on eating well, staying hydrated, going routinely to your doctor's visits, having doctors who are well versed and knowledgeable about sickle cell disease and management, taking your medications as prescribed. So, a lot of the time people are on hydroxyurea or folic acid or, other medications. And also, many people with sickle cell disease know the things that kind of put them into crisis, so they try to avoid those things. So they're usually good about trying to do that, but also avoiding infection, because if someone's sick, and you're around them and you get sick and you have sickle cell, that can easily put you into a crisis, because that's going to put stress on your body, and basically that can put you into a crisis. So those are some things that you can do to stay well and keeping yourself healthy. Now, if you do not have sickle cell disease, or you don't even know what I'm talking about, first of all, that's what this video is for, to spread awareness, spread knowledge, education about sickle cell. There are tests available. You can get tested for sickle cell trait. Also, you can donate blood, because as I said earlier in the video, sometimes when people with sickle cell disease get into a crisis, their hemoglobin can drop and they can get into severe anemia, which at that time they are going to require a blood transfusion. So donating blood is a great way to help out, even if you don't even know what I'm talking about, right? So if you knew nothing at all prior to this video, that is one thing you can do to help out people with sickle cell disease. I just want to make sure I'm not missing anything on my notes, but those are the main things about sickle cell. If you do have anyone who does have sickle cell disease, or people that you know with the trait, you can share this video with them. If you have any questions about sickle cell disease, or any further information that you can gain to learn, you can put those questions in the comment section below as well. I'm going to have information in the description box where you can go and get more information about sickle cell disease, what you can do to get educated, how you can get yourself tested for sickle cell trait, and all of those things. I will put links for that in the information description box. But like I said, if you did learn anything from this video, please hit that like button, subscribe to my channel, because I do tons of videos about health and wellness, education, making sure that you can pretty much have some responsibility, knowledge, and be very autonomous with your health and your wellness, and basically just helping you to be a better you that you can be, by giving you education, knowledge, awareness, letting you know what's going on in this world with conditions, so that you can basically be healthier, because that's what my channel is about, basically. So if you did like this video, like I said, please subscribe to my YouTube channel. If you have any requests for future Wonderful Wednesdays, because I do this every Wednesday, and if you do have a topic or condition that you have questions about, or you want to hear me talk about, you can put those requests in the comment section below. But again, as always, I do thank you for sharing this Wonderful Wednesday with me. Be blessed and stay healthy.